time. Inhale all the way in. Good. Okay. One more time. Inhale all the way up. Good. Okay. Lower back inhale. Hold. Okay. Good. Okay. Please start one side. Good.
真没什么，那个是烧的。身体的火箭，是在身体上，干嘛来？这个是。
哦，有个飞行吗？
是，它是那个。
Screw start a little bit. You guys go somewhere? Go somewhere to eat? Oh, where you guys going?
I don't know yet.
Oh.
Probably will look around.
Okay, yeah, make sure you relax, alright? Relax, Josh. Oh, yeah, good.
What?
He's as tall as you.
Oh, yes. Look at it. His mom is tall. And dad's tall too.
I'm tiny.
You gotta need a stool for it.
Oh! No, no.
You're gonna have to jump.
坐好。
Okay,
Right.
okay, one more.
And
Like,
he's gonna have to
sit,
figure
no,
out this.
okay, slide down a little bit, do some stretch there. Okay, good. Little bit more.
他也要喝拉。
Oh, perfect, good, stay here.
His neck's gonna go.
Oh, good.
他是来看到了，他要做8点，8点。
Okay, so put your head a little bit more.
Hold on,
Just
that's
do some
not-
stretching. Oh, relax.
What do you want to eat? We'll see. There's so many restaurants.
Okay, just
Loud, loud.
I see. 医生其实他力气比较，因为能买什么？
So what if I stay here a bit, okay? Do you feel anything like move, like
Yeah.
neck, low back, like maybe leg, right?
Yeah.
Leg, okay, good. Okay, I'm gonna help you get up now.
你以为能买衣服？
So, okay, both legs ready, okay? But like, tell me how you feel, like neck, like a little bit better, right?
Yeah, relief.
Really?
Really?
Yeah.
The
Good.
funny part is when I move, I can hear the bones, and
Mhm.
right now I can't hear the bones.
Oh,
smooth.
okay, it's getting better. Yeah, your neck.
Because you know, like the ones that were touching,
Uh-huh.
I can always hear them crunch, crunch, crunch.
你要搞吗？
But now I don't hear them right now.
Yeah, your neck.
Just-
Yeah. But you gonna get better fast.
Yeah.
Thank you, Robert. Thank
Thank
you. So you guys go somewhere to eat, okay?